Welcome to the Encephalitis International Podcast. Today we are joined by Doctor Tarun Dua, Head of the Brain Health Unit at the World Health Organization. Dr. Dua and I have been working together over the last 3 years or so, trying to drive the agenda on encephalitis since the inception of our global report and gap analysis on the condition and the subsequent publication of the WHO meeting report, Why Encephalitis Matters. In exciting news for World Encephalitis Day 2025, the World Health Organization are releasing a technical brief on encephalitis, supported and funded by Encephalitis International. And it's that we're here to talk about today, along with a better understanding of a little bit more about the work of the World Health Organization. So welcome to the Encephalitis International podcast, Tarun.
Hi, Eva, and very nice to be here to talk about the technical brief on encephalitis.
It's fantastic to have you on the programme. Let's get right into some of the questions. I think, first of all, let's start with a little bit about you. Can you tell us a little bit about your role within the World Health Organization and what the World Health Organization does when it comes to neurological conditions?
So, as you mentioned, Eva, I'm heading the Brain Health Unit, which sits within the Department of Mental Health, Brain Health, and Substance Use at WHO headquarters. And the unit has two broad areas of work. One is promoting and protecting brain health across the life course, and the second is around the diagnosis, treatment, and care, as well as prevention of various neurological conditions, again, taking that life course approach. So that's so as you can see, this is an important area of work, and I say that because of the burden that we see in the world today because of neurological conditions. They are the leading cause of disability and death. 1 in 3 people will have a neurological condition at some time. The important point to remember that the majority of the burden, more than 80% of the burden, lies in low and middle income countries. Now, while we understand and acknowledge the high burden that is due to neurological conditions and brain infections, since we are talking about encephalitis, they are amongst one of the important causes, be it meningitis, encephalitis, and meningoencephalitis. In fact, if you look at the ranking of encephalitis, it's the top. It's a number 13, so it's very high in terms of the burden that we see. Now, high burden. Do we have sufficient response at country level to tackle this high burden that we see because of neurological conditions? Unfortunately, no. The treatment gap for many of these neurological conditions is very high. For example, if we take epilepsy, which is a very common condition, in low-income countries, the treatment gap is 75%. And the reason for this high treatment gap are both on supply side as well as demand side. So, for example, there's lack of access to medications, lack of access to diagnostics, lack of access to specialists, or even the lack of access of training of primary healthcare providers. The system is not equipped to deal with many of these neurological conditions. And on the other side, we have the poor understanding, poor awareness, stigma, discrimination that we see for many of these conditions. So, for example, thinking about encephalitis, you have sequelae like any physical impairment, you have epilepsy. All of these are highly stigmatized condition, and these are the reasons that we see such high treatment gap. Now, am I painting a gloomy picture? I am, but is there a ray of hope? Yes, it is. It is the intersectoral action plan on epilepsy and other neurological disorders, which we fondly call as IGAP, that brought together the huge burden that we see, the response that is needed by countries, by WHO, by all partners, including all of us.
Absolutely. And I'm going to talk to you a little bit more about the IGAP in a moment. But first of all, have you learned anything about encephalitis during our work together? Has there been anything that surprised you?
So, Eva, I think as we know, there has been a lot of scientific discoveries, evolution of information that has been happening in the last few years. And one of the things that as WHO we looked at encephalitis was from a public health angle. So that is that I would say is I would say that was a different take on encephalitis. That very often you take a very clinical oriented, research oriented take, and not a public health oriented take, which is important because you need to keep the person at the center of all the responses that you take. And we forget when we are sitting in our fancy clinics, we forget that it's the person who's the holistic nature of the care that is very important. So that is, I think, I would say, very important when we think about encephalitis. The second is about the how the environment, the changing environment is impacting health. And climate change, for example, so which has led to increase in many of the vector-borne diseases, including encephalitis and the geographical spread. So, for example, one would never think about tick-borne encephalitis in Europe or Japanese encephalitis in Australia, but now we are not seeing any boundaries as we are thinking about these illnesses. And to think and to remember that when we are thinking about our epidemic preparedness, many of these newer viruses, for example, do have a component of brain infection or encephalitis. So that has to be part of the response that we need to talk about. On the other hand, the scientific discovery in the field of autoantibodies, and we are getting to know more and more about autoimmune encephalitis. And the data, we still don't have the kind of the data we need from low and middle income countries. Much more work is done, but I think this also has implications when we are thinking about the treatment and the care responses. And that brings me in terms of how do we need to look at the innovations into diagnostics, point of care tests, in terms of strengthening so we don't only need to strengthen our health systems, we also need to strengthen our research in these various areas.
Yeah, some really important points there. Thank you, Tarun. You spoke earlier about the Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders, or the IGAP, as you mentioned, it's fondly known as. Tell us a little bit more about that plan and the collaborations that are important in order to achieve it.
So as I mentioned earlier, IGAP was endorsed by all countries in the world to tackle the huge burden and the unmet needs that we see in the area of neurological conditions. This was endorsed in 2022. And IGAP has the vision to promote and protect brain health, but also prevent neurological disorders, provide diagnosis, treatment, and care, and improve quality of life for people who have these conditions. So it's very comprehensive. And it does so by having 5 strategic objectives. And so starting from that, we need to have supportive policies and governance. We need to invest in diagnosis, treatment, and care. We need to invest in prevention. We need to invest in research. We need to invest in better data. So these are the various strategic objectives. It comes with its plan of monitoring, indicators, and the targets that are there. The important point that I would like to highlight here is that this is something that as WHO we cannot do alone. This is something a country cannot do it alone. It requires partnerships at national, regional, and a global level. And these partners include academics, research institutions. It includes civil society NGOs like Encephalitis International, and most importantly, people with lived experience and their families. They are an important partner, and this is what we have. What we see and reflect in our day-to-day work that we do is to involve people with lived experience in all, in terms of planning, in terms of development, in terms of implementation.
Absolutely. It's a fantastic initiative. In addition, the World Health Organization is releasing a technical brief on encephalitis to coincide with World Encephalitis Day. But tell us, what is a technical brief?
So the idea, as I said earlier, is that we need to focus on the public health aspects of health, and you have different standard textbooks. They broadly talk about they can provide you all the information, but how do we distill the information that is important for policymakers, program managers, people who are investing in public health, people who are the healthcare providers who are looking at the holistic care. And this is what the technical brief does. So these are the series of briefs, and we have done previously for epilepsy. We have done previously, Parkinson disease, is that they strengthen our implementation of IGAP at country level. So providing approaches, recommendations that countries can follow, the policymakers can follow.
And what are the key points relating to encephalitis, do you think, in this technical brief?
So first is, while we know about the burden of encephalitis, there are still major gaps in terms of the data across, especially from low and middle income countries. But whatever we know, it's a significant public health challenge. And it is also an increasing global threat. I mentioned about climate change, urbanization, demographic changes. All of these changes are leading to increase in the incidence of encephalitis that we see. Now, the third point is that what can be done about it? I think in terms of we need to scale up, we need to invest in robust surveillance systems to know more about the burden. We need to invest in vaccination strategies in terms of identifying new vaccines where they don't exist, and scaling up vaccinations where they are available. So that's for the prevention data surveillance part. The most important message that this brief comes out about is the strengthening health systems, because health systems are important for prevention. They are important for early diagnosis. And we know if you diagnose early, you can decrease the sequelae, you can decrease the death. They are responsible for providing treatment and care, not only for encephalitis, but people who have sequelae and consequences. And I think that comprehensive approach, that continuum of care, that is extremely important.
Absolutely.
I mentioned the research that is needed earlier, and I think that is an important message, that we need both discovery, research, innovations, new technological developments, but also implementation research in terms of scaling up the new interventions. And lastly, that this, as we think about any public health initiative, it is important that we explore work together in synergies. So for example, we have Defeating Meningitis Roadmap or Arbovirus Initiative or ICAP. So it is about that integrated approach, that synergistic approach, that is extremely important.
Absolutely. Well, we were thrilled when the World Health Organization wanted to release the report, which is one of the biggest advances, in our opinion, in encephalitis policy globally, to coincide with World Encephalitis Day. Why do you think World Encephalitis Day is important?
So I think the different days, and in this case, World Encephalitis Day, they play an important role because there is lack of public awareness and understanding about many of these conditions. And I think having this dedicated day provides an opportunity for focused, committed advocacy around encephalitis. So it makes sense that as WHO, when we are releasing such an important resource for policymakers and program managers, we link up with the World Encephalitis Day so that we can have multiplication, amplification of the messages using the different channels. What is very important is it's not only the publication of the brief, but it is the dissemination, it's the sensitization and the advocacy. So while we are releasing the day, the report on the day, we need continuous advocacy throughout the year and going forward. So these messages are picked up.
Absolutely. How can the technical brief be implemented across different member states, and how can policymakers be engaged with to implement it?
So as I said earlier, this is an area where one partner cannot do it alone. We need engagement by multiple partners, multiple stakeholders. So this requires involvement of academic institutions, research organizations, philanthropic foundations, funding agencies, civil society, different NGO partners, people with lived experience. We need everybody to come together. We need to have that kind of a multi-stakeholder response. This is something also that requires a multi-sectoral response, because as we talked about, arboviruses that are responsible, climate change, we require sensitization of other sectors, the One Health approach. I think that is important. I mentioned and would like to re-emphasize is the synergies with other initiatives. That is extremely important. So defeating meningitis, the countries are already investing in vaccination, surveillance, diagnosis, treatment, and care. How can we work together? And lastly, in terms of constant advocacy and commitment to address this burden, I think that's the need of the hour.
Absolutely. Well, we're coming to the end of the podcast now, and I wondered in closing whether there was anything that we've not covered that you wished I'd asked you, or anything else that you'd like to add.
No, thank you once again, Eva, for having this opportunity to talk about encephalitis, and thanks to Encephalitis International for their partnership and support to WHO. I think, as I said, we all need to come together to address the huge gaps that we see, the inequities that we see, and to address the barriers and the challenges that we are seeing in terms of the diagnosis, treatment, and care. So fostering collaboration is extremely important, and we do hope that our working together will help us prioritize encephalitis in the public health agendas. So thank you very much once again.
Thank you, Dr. Dua, and wise words on which to finish this podcast. We've come to the end of this enlightening conversation with Dr. Dua. We hope that you've all gained some insights into encephalitis, the operations of a technical brief, and the complex and vital work of the World Health Organization. I'd like to thank Dr. Dua for taking time out from her global work to share her knowledge with us today, and to thank her for being so open to hearing what we had to say right back in 2021 when we first approached the WHO. Finally, I want to thank you, the listener, for listening. Remember, whether you're dealing with encephalitis and its after effects, or you're supporting someone who is, you're not alone in this journey. Encephalitis International are here to help and support you in whatever way we can. For more information, as well as our contact details, please visit our website, encephalitis.info, and together we can achieve our aim of ending death and disability from this condition. You can find all the information you need in the podcast description. As always, if you can support our work, we would be very grateful. Please visit encephalitis.info/donate. Thank you again, and we will see you all next time on the Encephalitis Podcast.